So first I wanted to set the stage. Healthcare has been transformed over the past century. In fact, it's really transformed over the past 50 years. We've moved from a incredibly palliative care-based model of healthcare delivery to a technologically intensive one. One of large wards staffed by nurses looking after the sick and the dying, perhaps those who returned from wars overseas or wars domestic, going back even further to the Spanish-American War, for example. Today's hospital environment looks very different, and those of you who have spent time in hospitals, as I suspect many of you on this call will have done so, will have noticed the transition from the palliative care model to one of today's technologically advanced patient room with a plethora of IoT and IT attached devices that monitor patient sats and do all kinds of other things to ensure that patient care is optimized during your time in hospital. Technologically, our healthcare has evolved very rapidly. And this has been reflected in the distribution of patient outcomes, which have increased dramatically over the course of the last century. Technology, pardon me, has played a major part in saving lives. And the photograph on the right here displays the iron lungs, famous from the 1950s, famous from the 1950s for saving those patients who found it difficult to breathe under poliomyelitis. This was obviously before wide-scale vaccination, a subject that is today very topical given our current COVID crisis. You'll note today that the breathing apparatus of the 1950s is significantly different from the breathing apparatus and intubation methods that we use today as a result of technological advancement. Technology has helped to improve the human condition. It's helped us to beat diseases. It's helped us to prevent the widespread spread of infectious diseases, with the exception of COVID so far. And we've been able to annihilate a lot of the diseases that plagued humankind for much of the last 100 years or more. Technology has really transformed outcome, and digitalization across healthcare is both persistent and ongoing. We can see that in terms of the technology that's implemented and the integration of those technologies across disparate providers, insurers, pharmacies, organizations, etc. But technology has also introduced risks to our environment, and none more so than, of course, than your friendly neighborhood hacker or nation state activist. These have in many ways changed the paradigm of computing and have led to a growth in the Internet of Things, which now is prolific across our healthcare environment, with network connected devices that do just about everything in our hospitals, from building management systems right the way through to network connected infusion pumps, to patient telemetry systems, to the large-scale diagnostic equipment that is used to determine your condition and the course of treatment that you receive when you're in hospital. However, this growth in IoT in our hospital environments has vastly outstripped the IT environment, to the extent that IoT connected devices in our hospitals are an order of magnitude greater than traditional IT systems, workstations, cows, wows, carts, servers in our hospital data centers. In 2008, the things connected to the internet surpassed the human global population. Now, I'm not going to say that Skynet is imminent or that we're all going to be attacked by Terminators anytime soon, but I think this portrays the state of play across the industry today. And as of the end of this year, according to Cisco, there'll be 20 billion smart devices, and by 2050, 1 trillion smart devices connected to the internet and accessible to us from our smartphones or from the internet. This really changes the paradigm, and I think we need to adjust our care model in healthcare and our security model in healthcare in order to reflect this. There has been a massive explosion in the number of medical devices in hospitals, and as I mentioned earlier, those of you that work in the space will have recognized the transition. Everything from surgical robots, Da Vinci surgical implements, for example, that are network connected and programmed to perform a particular operation perfectly 100% of the time, right the way through to your mundane day-to-day Pixis cabinets for the distribution of drugs. These are all network connected. And if the network goes down, or if these get infected by malware or by a hacker, then obviously things go wrong very quickly. Pharmacy robots that select drugs and dispense those to nurses in order to give to patients, right the way through to a multitude of different devices. And this increases the threat surface in our hospital environment to the extent that ransomware and other forms of extortion might not necessarily be against data in the future. We've seen WannaCry that took down a large part of the NHS, and the next speaker will be talking about some of the trials and tribulations that the British health system has had to undergo as a result of changes in cybersecurity posture. But it's quite feasible that the next level of extortion, of ransomware, won't be against patient data. It may be against connected patients who are connected via their medical device to the apparatus that is being used to diagnose, treat, monitor, manage those patients in our hospital systems. So how do we go about securing healthcare, right? This is a new challenge, right? We train our physicians to look for particular ailments, to look for conditions, and to treat patients accordingly. We don't train our physicians today to look for potential indicators of cybersecurity attack or compromise of the IT equipment or HIoT equipment that they're using in order to render care to patients. Perhaps this is something that we need to consider. How do we, above all, ensure patient safety when patients are so connected in our hospital systems? Well, today we've assembled some of the top minds, some of the top experts in healthcare security across the world, in fact. We've got representatives from the United Kingdom, from Canada, and from both coasts of the United States and right the way across the middle. A lot of CISOs and CIOs and CMIOs, a lot of practicing physicians and other specialties that will be sharing their information, sharing their thoughts, their opinions, their research with us today.